Rumor has it that these are very, very false. Hello everyone, I am Janelle, the SLP Peep, and today, and for this month, we're talking about rumors. If you have not already, please hit that subscribe button so that way you get notified every single time I upload a video. So, rumors. Rumors are hard to get rid of. A lot of people are stuck believing what they want to believe, and 9 times out of 10, if not more, they're false. Today, we're going to be busting some of the most common rumors that I have heard or rumors that you may have heard as well. Great news, this video is not sponsored, so I don't have to go into that spiel. Let's go on. Myth. AAC prevents verbal speech. So let's talk about AAC and the purpose of AAC. AAC is a means for communication. For some individuals, AAC, this is their only means of communication. They may not have the equipment or the strength to verbally communicate. In my practice that I see right now, AAC does not prevent, it actually assists with verbal communication. Case in point is I have a kiddo that just got an AAC device. I don't remember the name of it right now. And he's been verbalizing more for 2 weeks. What AAC does, it allows a person to hear the words multiple times without any variation. And you know what? That works for them. Myth. Only nonverbal people use AAC. The concept that only nonverbal people can use AAC, I can understand where they're coming from, but this is totally not the case. AAC is for anyone at all. Like seriously, anyone. I have an AAC, chances are you have an AAC, and we don't think of these devices as AAC because we know them as a different word. Smartphones. Technically, that's 2 words, but whatever, you get what I mean. But smartphones help us communicate to the world around us. So almost everyone has an AAC device. We just don't think of it as that because it was not introduced to us as an AAC device. There are cases where verbal people even have AAC, they just use it in different scenarios or different settings. Myth. They just got hearing aids, they'll be fine now. Oh boy. There's this concept called listening, and it is a skill. So when a person gets hearing aids or a cochlear implant, more so with cochlear implants than hearing aids, a person has what's called hearing age. For most people, at least people that don't necessarily qualify for hearing aids or cochlear implants, we also have a hearing age. It's just the same as our chronological age. Those that have cochlear implants or hearing aids, they may not have the same age chronologically as they do for hearing. This is not the same as receptive understanding, but it is tied along with it. It's, are you listening or are you paying attention to the input that you're hearing? This is covered under the ASHA Big 9 for speech language pathologists. It is under oral rehabilitation / habilitation. Myth. Newborn hearing screens are not worth it. Speaking of hearing aids and cochlear implants, newborn screenings are so important. The reason why this is important is similar to the APGAR score. We want to know what is the best prediction right now. Newborn hearing screenings are done by checking the vestibular nerve. If it picks up noise and if it sends feedback, that's more of an audiologist thing. But considering that audiologists and speech language pathologists are kind of tied, thanks ASHA, this also gives us an indicator if there might be some hearing loss or some issues with hearing in general, and what us clinicians and you caregivers can expect or watch out for in the next few days, weeks, months, and even years down the road. Myth. The youngest age a child can be tested is whatever age you've heard. I have heard families say they could not get their child evaluated for speech and language delays until the child was 3. This angers SLPs. The youngest child I have actually evaluated, I believe, was 17 months. But in all honesty, we're able to evaluate children that are so much younger than that. A child is never too young to be evaluated. Some things you may want to look for with young children is 6 to 9 months. Are they babbling? At 1 year old, are they communicating with you with one word? My takeaway for this is it's never too young to be evaluated. And if you have concerns, bring them up and let's find out. Myth. Don't be worried about boys not talking. They talk later than girls. Is there a difference between the language development of boys versus girls? Yes. Is it enough to warrant this rumor? No. Now, when we do our assessments and our examinations, on some of them, there are timing for girls and timing for boys. The difference is mainly in 3 to 6 month gaps. Myth. My child is lazy. Your child is not lazy. In fact, they're probably the opposite of lazy, which is they're so flippin' smart, they have found the easy way through it. Children learn by what has been rewarded to them. If a caregiver or a sibling has always spoken for them, then the child has learned, I don't need to speak. I can just do whatever I want. That's one reason why therapy for pediatrics is so difficult, is you're essentially flipping the child's world on their head. Your child is not lazy if they do not speak. It's either something they've learned that they don't have to do, or they might be apprehensive or scared to do it, or better yet, verbally speaking may be really difficult for them, so they have found an easier way to communicate that does not require verbal language. Myth. The simpler the speech, the better. In my therapy, I like to mix it all together. I like to demonstrate the longer sentences, the simple sentences, the 2-word phrases. I like doing all of it. Using simple sentences or simple words and mashing them together into a phrase can be beneficial. To use it as your only means of modeling what to say for a child is not. They get to hear where they're at right now, what we're asking them to do, and what we would like them to do later down the line, whether that's a year, 2 years, or even 6 months from now. Who knows? Some kids like to surprise me. Question of the day. What rumors have you heard? I know there were a lot of rumors out there. Feel free to drop any of the rumors down below. Thank you so much for watching. I hope you have a wonderful day. Bye-bye. Where did it go? This is actually something else. I can't believe I sound so depressed when I say that. Let's try that again. Oh gosh, let's see. That should work.